The CDC is warning about a distressing trend in the pandemic. Coronavirus cases are increasing in nearly 75% of the country. Over the past week, the U.S. averaged almost 60,000 new cases a day. The country is also seeing an average of more than 700 deaths a day, with the total now above 222,000. More than 1,100 people died just yesterday. Health and Human Services Secretary Alex Azar has called the trends concerning. He joins us now. Good morning, Mr. Secretary. Thanks for being with us. You said we're only weeks away from a safe and effective vaccine. When do you believe it would be widely available to the general population?
Well, Anthony, just to clarify, I think weeks to months. We can't predict exactly when we'll get data. So there are independent data and safety monitoring board that will have to review the data. A drug company will have to determine data meets their standards. And none of this happens, of course, till we get enough events in those clinical trials, and we have no control over that. What we've said is that we believe, because thanks to President Trump, we're manufacturing all 6 vaccines at commercial scale right now. We believe by the end of this year, we would have enough FDA-authorized vaccine to vaccinate our most vulnerable people. By the end of January, enough vaccine for all of our seniors, as well as our healthcare workers and first responders. And by the end of March to early April, enough for all Americans.
Health experts, Mr. Secretary, they say a vaccine won't immediately get us back to normal, that we could need to be taking precautions like wearing a mask well into next year. So how long do you think we're going to be living like this?
Well, Anthony, I don't want to speculate like that. Let's get the vaccines up and running. Let's get that vaccination program going. Let's see the effect that they have in terms of increasing what we would call herd immunity from vaccination. And then let's also see, we hope we'll be having these monoclonal antibody therapies fairly soon. We have 2 emergency use authorization submissions into FDA as the next generation treatments to help reduce severity and impact of this disease. But let's take it one day at a time rather than trying to forecast what things are going to look like many months from now.
Politico is reporting this morning, Mr. Secretary, that you are openly plotting the ouster of FDA Chief Stephen Hahn due to deep frustration with Hahn over his insistence that a COVID-19 vaccine meets stricter than normal safety standards. Do you have a problem with the FDA chief?
Absolutely untrue. In fact, Commissioner Hahn and I speak almost every day. We have a very close, productive relationship, and we're working together, as I have made very clear, and the commissioner has made clear. The FDA will make the decision whether to approve therapeutics or vaccines according to their science, data, regulatory, and legal standards. Those calls will be made ultimately by the top career officials at the FDA, and I 100% support that approach.
So you're confident he can lead the vaccine effort?
Absolutely.
Okay. I wanted to ask you, lawyers appointed by a judge to find parents who were separated from their children at the border say they can't locate or reach the families of 545 of those children. Those kids are under HHS care, which obviously you're in charge of. What is your plan for those children?
So, Anthony, let's actually be clear. You made a very substantial misstatement there. No child within our care is from any of the separation policies. That work by the ACLU with the court was under court order to look back to some activity that occurred back in 2017. None of the children associated with that are in our care. They're all out in foster care, or more importantly, with family members here in the United States. We are reviewing that filing, and we'll certainly work with the court on any proceedings related to that.
All right. The CDC, meanwhile, has updated its guidance on how the coronavirus can spread from person to person. Can you explain this new guidance and how perhaps we need to better protect ourselves?
Yeah, Anthony, let me make 3 key points. First, we're learning every day about this virus. Second, the CDC is going to update their guidance and educate the American people as we learn. This is really new information that we've learned from some recent studies. And third, here's what the guidance says, which is that we in the past had said that to be a close contact of somebody who might be infectious, you needed to have 15 minutes of continuous unbroken contact with them within 6 feet. Now the caution is that you might need to actually, if you have iterative interactions within that 6 feet, even if it's not 15 minutes unbroken, that you might also be a close contact. What this means is it's a real call to action to reiterate. Wash your hands, watch your distance, and when you cannot watch your distance, wear your face coverings to protect yourself and others, and stay out of settings where you can't do those things. So I think it's just a real up-to-date reminder of the absolute importance of practicing those 3 W's.
All right, Secretary Azar, thank you so much for being with us this morning.